Hi everyone, so I'm really excited to talk about vascular treatments. We're very lucky at Lucere. We have 2 lasers for vascular treatments at our Southside location, and downtown we have another 2. Vascular is a big topic because we're always talking about the caliber or size of the vessels that we're treating. So we can choose between lasers for a certain size. Sometimes we do something called sclerotherapy, where we're injecting something into the vessel to cause those vessels to shut down. We're lucky enough to have an expert at our surgical suite downtown who does something called EVLA, where they do a 3D ultrasound mapping of the vessel and find out exactly where the trouble is. But today I'm going to show you the most common problem people have. So rosacea is a very common condition, and it gives us gifts we don't always want or need. And the most common gift it gives us is it makes us red in the face and gives us a bunch of broken vessels. So I'm going to show you what we do about that right here. So we have a beautiful young lady who's agreed to let me talk you through what's going on. So if we zoom right into the side of the nose here, you see we have these little vessels. These vessels are called telangiectasias. They're tiny little vessels that have little branches to them. Now we have the ability with very precise treatments with lasers, and in this case I'm going to do a precise treatment which is a non-surgical, non-invasive treatment called the Vein Go to actually cause these to shrink up. And I love this treatment because it is so effective, and I'm happy for you to watch. And actually it's so satisfying, you'll see these vessels kind of collapse and disappear as I go. So come on in, I'll show you. So if you would recall, there were many large vessels on the right side of the nose, and we actually got pretty much all of them to close off and shut down. So she looks much clearer. I'll just do a few touch-up spots. It's so interesting because as you go, when you memorize how bad it was to begin with, you really see the difference after it's been treated good. Let's give her a mirror. Isn't that interesting?
It is interesting.
Yeah, you were fantastic. You can trace out a very large vessel here and a couple of branching vessels over here. So let's chase that large one to begin with. Look at that, very juicy vessels. So remember those branching vessels all over? They're gone with you. Well, there you have it. This was an excellent treatment demonstrating the value of a very specific fine pinpoint surgical device to help with little vessels. And this is a pain point that's otherwise very hard to treat effectively. Very happy with the results. How do you feel?
Great.
Happy with the results?
Very.
How was the pain?
It was very manageable.
Wonderful. Thank you so much.